Story 1. I am a pediatrician. We have had multiple babies and toddlers brought to the hospital by the police after being found alone in the home with their caregiver deceased. Story 2. There is a serious mental health impact and a shift in routine perceptions. I still feel as if going out of the house is a dream state and my home feels like reality. Story 3. So many people have recently gotten pets that veterinarians cannot keep up with the demand. There is a real chance animal shelters will be overwhelmed with abandoned pets when people stop working from home. Story 4. This Christmas is going to be a disaster. I work for a major department store that carries toys, and we are expecting to be sold out of everything by November. Even regular clothing is affected. We are still waiting for some products from factories that were supposed to arrive in July. We have had 2 years of crippled production across the board. But because of shipping times, we are only now starting to see the effects. Do your Christmas shopping now, or yesterday. Story 5. I am having suicidal thoughts because it feels like it will never end. I'm sorry you're feeling this way. If you are in immediate danger, call your local emergency number now. In the United States, call 911 for emergencies or call or text 988 for the Suicide and Crisis Lifeline. Reach out to a trusted person or a mental health professional. If you want, I can help find crisis resources in your area. Story 6. Children of parents with disabilities or immune disorders who are disproportionately affected by long coronavirus disease 2019 are now acting as informal carers, trying to care for their parents while attending school. Because of a lack of canvassing and the closure of charity shops in the United Kingdom, children's charities lost millions during the pandemic. Barnardo's, for example, lost £65 million. At the same time, up to 31% of children in the United Kingdom are now living in poverty, exacerbated by government cuts to services and support. The government is now reducing payments for families relying on universal credit by £80 a month while food and utility prices are skyrocketing. Story 7. Cognitive decline is occurring, even among those who are not infected. Lack of stimulation and excessive stress contribute. People's attention spans and memories are impaired, and their reasoning ability is diminished, including myself. Story 8. People who did not contract coronavirus disease 2019 but have ongoing health problems were less able to receive the care they normally would. There is an increase in 911 calls and emergency room visits because their conditions worsened and became medical emergencies. The health crisis caused by the pandemic is far-reaching and affects more than just people who contracted coronavirus disease 2019. I am a firefighter. Story 9. People have become extremely rude for a variety of reasons. Story 10. I am a 911 dispatcher in a small town. The number of domestic violence calls I have taken has skyrocketed. It is beginning to seriously drag me down and exhaust me. While helping local programs get food to families with children, I broke down when I realized some children only get food at school. Story 11. I haven't heard many people talk about it, but I had, and still have, survivor's guilt. The man in recovery next to me passed away in the middle of the night. We had our hospital dinner hours earlier and had a great conversation. Just before we went to sleep, he said, "Hey, I really like you, man. Once we get out of here, let's get actual dinner." I said, "Absolutely, anything would be better than this stuff." Later that night, I heard his monitor alarm go off. We were separated by curtains, and I heard nurses and doctors come in and wheel him out while they called for the defibrillator. I don't remember much, but that has stuck with me mainly because I thought I was next. I figured I would never see my wife, family, or friends again, so I was trying my best to come to terms. I didn't find the peace everyone says you find near death. After 47 days, 10 in the intensive care unit, I was able to leave. A year and a half later, I am here telling you all about my experience. I still think of that man often. I don't remember his name or what he looked like. I just know our conversations helped us through. Thank you all for your kind words and awards. Story 12. This is a bit embarrassing because I am in my 20s, but the lockdown caused me to develop hemorrhoids. It is common among people who sit a lot for work, and because of the lockdown I get less exercise. Here I am with fucking hemorrhoids on top of all the stress and chaos of the pandemic. Edit. Rest in peace, my inbox. Story 13. As a dental student, I see many people who have neglected their teeth but otherwise would not have. Examples include missed regular cleanings, missed checkups, failure to return for definitive treatment, and wearing a temporary crown for 18 months. This is partly the fault of dental offices canceling appointments indefinitely and failing to reschedule patients, but also partly due to patient fear of catching coronavirus disease 2019 from other patients and similar concerns. In short, more people's teeth are in worse condition. Note: other contributing factors include being home all day, eating more frequently, and consuming more sugary foods. Lack of a pre-work routine means oral hygiene habits are poor. Increased stress has also led to more clenching and grinding, causing teeth to become worn down. Story 14. My high school students are woefully lacking in behavior and in meeting social expectations. They seem to have no idea how to function at school. This group has been affected by the pandemic since grade 8, when work habits usually form. It will take a few years to rebuild. Story 15. I work in mental health. It is rough out there. Story 16. How much were people with hearing loss affected? My mother, who wears hearing aids, depends on lip reading, especially in loud, busy places. Hearing aids can have trouble separating sounds in noisy environments. You can imagine what happened when everyone covered their mouths. Now she is more isolated than ever. Since then, I have run into a coworker who is also hard of hearing but does not want to return to the office because, while she can read lips on video calls, she will not be able to if we wear masks in person. People with hearing loss became an invisible casualty of the pandemic. The response to this has been more than I expected. If anyone has links to organizations to donate to that support people with hearing loss, please share them. I hope the stories below help us all be more empathetic to each other. Thank you. Story 17. Parts are harder to obtain and everything is more expensive. Story 18. Fewer cases of cancer and other serious diseases are diagnosed and treated, and fewer necessary surgeries are performed because hospital staff have been reassigned to wards caring for patients with coronavirus disease 2019. Fewer referrals are written to avoid overwhelming specialists. In-person health services are becoming harder to access, so fewer cases of conditions such as skin cancer are diagnosed. The health of the whole population suffers, not only those affected by coronavirus disease 2019. Story 19. My memory is trashed. I clicked on a movie in our recent downloads and asked if we wanted to watch it. My husband was alarmed because we had apparently watched it 2 days earlier. He went through it with me scene by scene, but I have no memory of it. I now frequently forget the door code at work. My mother is under a lot of stress and I speak to her daily. Sometimes I forget the people she is talking about or entire conversations, and I feel like an awful daughter. I have never had memory problems before. This began after I had coronavirus disease 2019, from which I was very ill for about a month when I was 29. I am now 30. My doctor's response was that nothing can be done because the long-term memory effects are not yet being researched, so I am left in limbo. Managers give me tasks at work, and before I finish one I forget another, so everyone thinks I am incompetent. Since cognitive problems after coronavirus disease 2019 are not yet officially recognized, most people assume I am at fault. I have 2 degrees and I now struggle in a mediocre job. I lost my previous position, where I had responsibilities during the pandemic. This is very distressing. Story 20. I am a prosthetist, and I am not sure people are aware that amputation can occur after coronavirus disease 2019. I work in a small private clinic, and we have about 15 patients who have had various levels of amputation due to coronavirus disease 2019. I would like to know the statistics. Story 21. People who were furloughed had time to realize they hate their jobs. I can only speak about the service industry, but it feels more soul-crushing than before. I used to love bartending, and now I feel trapped. The money does not seem worth it. Guests are worse and more entitled, and staff shortages have made shifts harder and longer. This has left me feeling hopeless. It is the only career I have known, but I cannot imagine continuing. Story 22. The founder of Texas Roadhouse died by suicide due to severe tinnitus caused by coronavirus disease 2019. Story 23. The work environment has been rather toxic. I work in a company where some people have the option to stay home while others do not, and it has caused some resentment between departments. Story 24. Older adults are being cut off from their children and from social interactions. Many of them are suffering in silence. If you have not spoken to your parents or grandparents in a while, call them. Story 25. A sharp increase in domestic abuse has occurred as families are forced to stay inside together, compounded by financial pressures and by people being trapped with abusive partners and having nowhere to go. Story 26. My brother, who works for the Department of Social Services, said that during the pandemic child abuse reports plummeted. That likely means, unfortunately, that there were not fewer incidents of abuse but fewer opportunities for people such as teachers to notice and report the signs. Story 27. I am a therapist specializing in bereavement, working with a local hospice. The past 18 months have been brutal. The amount of trauma and the number of stalled or complicated grief responses I have seen have increased. Not being able to mourn properly, to be with someone as they die, to visit, to hold proper funerals, or to hug or sit close when saying goodbye has greatly increased the difficulty people face in processing loss and grief. Even when the person did not die of coronavirus disease 2019. We rely on rituals, mourning processes, and community support to help us come to terms with and cope with loss. Many of these comforts have been denied to people, both to those dying and those left behind. It has been a grueling and incredibly depressing 18 months in this field, and I expect a large amount of unresolved trauma and complicated grief in the coming years. I am blown away by the response to my reply. Thank you for the upvotes and awards, and especially for sharing your stories. I may not be able to keep up with all replies and messages, but I will do my best to read and respond when I can. The response shows how much we have in common as we move through this pandemic. So many stories of trauma, sadness, and grief. Healing can begin when we share the burdens we carry and feel truly heard. For anyone struggling with grief, please reach out to support groups or organizations that may be able to help. Demand for therapeutic services is at an all-time high, but we are doing our best to help as many people as we can. While grief itself is devastating, the complications of trying to mourn during a pandemic can lead to responses similar to post-traumatic stress disorder, such as intrusive thoughts and images, preoccupation with the person who has died or the manner of death, low mood and depression, anxiety, hypervigilance, and feelings of isolation or dissociation. Grief is inevitably painful, but stalled grief can be overwhelming. Please reach out for help. You do not have to do this alone. For those of us in the helping professions, carers, therapists, healthcare workers, and so on, your mental health is as important as the people you help. Vicarious trauma and burnout are real, and you will also need support. We are dealing with a collective trauma. The closest experience this can be likened to is war. We will need each other to make it through. Thank you again. Story 28. There will be a rise in drug and alcohol addiction as a result of this. I guarantee it. Story 29. Dog rescues are facing increased pressure as people return to work and find their dogs have severe separation anxiety due to lack of proper training. Story 30. I have noticed many young adults who, before COVID-19, were still adolescents but are now considered adults. My brother turned 18 a week before the lockdown in the United Kingdom. He is now almost 21. People see his age and expect him to be more mature, but he still feels like an 18-year-old. I feel for that age group. They missed important formative years that teach how to live and interact in an adult world. His anxiety is very high, and he has gone from being quite independent to someone who constantly needs confirmation and validation. I am sure this is similar for many people his age. Story 31. Being single felt crushingly lonely, especially if you were already looking for someone. Story 32. Addiction. I have recently gotten clean and am rebuilding my life. Before the pandemic, I had a good job and was happy and healthy. Due to added stress, losing my job, and worrying about my family, I began using again. One use led to another, and I quickly became addicted to heroin. I lost everything I had built and watched many others fall as well. Many have not made it back. Story 33. A general decline in people's social skills, especially among introverted individuals and young children who started school during the pandemic. Story 34. For me, it's been far too easy to isolate. I do not have to go outside my house except to take out the trash. Everything can be delivered. A local laundromat even briefly cashed in on the craze by picking up dirty laundry at customers' homes and returning it clean. My depression and social anxiety have flourished. Story 35. One of the largest transfers of wealth from the poor to the already wealthy in history. Story 36. Hospital protocols prevented us from being with my father when he had emergency open heart surgery in November, and we could not be with him during his hospital recovery. That was the hardest part for him and for our family because he was alone and miserable. In December, my grandmother was diagnosed with brain cancer, and we could not be with her in the hospital when she was told she had a terminal illness. It was heartbreaking. Story 37. Increased addiction to social media and greater restlessness when separated from it, especially among teenagers. Story 38. There is more division between families because of opinions and beliefs about how to respond to coronavirus disease 2019. Story 39. My father works in education, specifically in educational technology. He says he occasionally logs on to kindergarten through 5th grade classes, and it is pure chaos, with teachers trying to sing the alphabet while children ignore them, grandparents accidentally turning cameras off, and broken Chromebooks everywhere. Middle school is just as bad for different reasons. He is convinced that the pandemic will produce one of the most educationally underdeveloped generations in decades, and we will feel the effects for years to come. Story 40. We were watching The Office the other day, and my 4-year-old asked why they were not wearing masks. We had to remind him that life used to be different. I can only imagine what is going through our children's heads. Story 41. Everyone else has mentioned mental health, but I think it is worth pointing out how coronavirus disease 2019 massively accentuated political and social divisions within Western countries. Story 42. I had a baby right before the pandemic hit, in mid-2019. She does not know a world where people are not wearing masks. When we go outside, she tries to put one on, even if we are just going to the mailbox. She has never been to the park, the beach, the mountains, the zoo, or the aquarium. She has almost never seen another baby except on screens. She has never been to a restaurant or a shopping mall. We had to cancel every trip, vacation, and birthday party for the past year and a half. We even had to cancel our trip to Disney that we had been saving for since I became pregnant with her. I cannot even take her shopping because people here in Alabama refuse to mask up, and every day my older son goes to school there is a risk he will bring the coronavirus home. He is too young for the vaccine. If my kids get it, I do not want to think about it. My husband's mental health has taken a massive hit since he was laid off in 2020. He was suicidal a few months ago, which was terrifying. I also lost 3 loved ones last year and received almost no empathy. My brother-in-law died in November, and my managers were thumbing through manuals before I even finished my sentence to see if I should be allowed time off to attend the funeral. Thankfully, it was my day off. Still, how is it that an employer can tell you which family members are worth a day or 2 of bereavement and which are not? This has gone on so long that I feel everyone is suffering from compassion fatigue. 20 years ago, we collectively stopped everything and mourned 2,000 people killed in a single day during the World Trade Center attacks. That number now happens every day, and we are too burned out to even acknowledge it. After 18 months, we hear the numbers on the news, sigh, and get back to work. The callousness is overwhelming. Millions are dying, and we are all going about our business like it is a regular Tuesday. There is no compassion for those who are struggling. Even with vaccines available, nothing has really improved because not enough people are getting vaccinated. We have needed help for so long that the alarm bells that have been ringing for 18 months have become white noise. You cannot finish reading one tragic article before another one appears with an even worse tragedy. Headlines scream that the virus is killing people, child abuse cases are rising, there was another mass shooting, the virus has mutated again, shortages of food and clean water are worsening, homelessness is at an all-time high, natural disasters devastate communities, rent is rising while minimum wage has not, and climate change threatens everything. It feels like we are all working in a burning building and management is telling everyone to stay calm and keep working. Half the company is yelling that we should put the fire out or we will all die. The other half is shouting that we cannot stop everything just to put the fire out because of the production schedule. Management suggests keeping a fire extinguisher on your person. Half the employees say they have a fire extinguisher and want to use it, and the other half insist they will not tote an extinguisher around all day because they have rights. Then the fire spreads when those who refused protection are affected, and by the time they beg for the extinguisher, it is too late. Story 43. Personally, it changed my view of the world a lot. I was finishing college when the pandemic hit and spent my first year after graduation at home with no job and nowhere to go. Any post-college plan I had went out the window. I now consider things I never did before because I see the world differently, such as being unsure what to do with my life and not wanting to deal with so much nonsense from society. Ultimately, I have realized how messed up we all are and that I want to live my life without being bogged down by so many societal constructs. Story 44. The number of people who had just sunk their entire life savings, second mortgages on their homes, and their children's education funds into that promising new business that was supposed to be a surefire hit and make huge profits was staggering. Then, within a month, the lockdowns during the coronavirus disease 2019 pandemic began. Thousands of people had their life dreams and futures utterly crushed and are still in shock at the craters they find themselves in. Story 45. A coworker at the grocery store, the second in 1 year, died by suicide recently. Mental health and addiction were factors. Management also lowered our wages during the pandemic, which reflects greed. Story 46. I can't stand a lot of people I was totally cool with before the coronavirus disease 2019 pandemic. Story 47. I worked for 10 years to make my anxiety go away through exposure therapy. Now I am back to square one. I have a panic attack as soon as I walk out of the house. 10 years of work, gone. I have never felt my depression this bad. Edit. Thank you everyone for your kind words. You have made me feel so much better. Story 48. During the COVID-19 lockdowns, pediatric obesity increased. The rate of increase doubled, according to the Centers for Disease Control and Prevention. Story 49. When people are laid off, they often do not realize how bad their mental health is until they no longer have work to distract them. Bodies can remain in freezers for months. Regardless of the cause of death, they may stay there until the funeral. The spread of misinformation has destroyed friendships and families and even led to loss of life. Story 50. There is an increase in echo chambers on social media, including Reddit. An echo chamber is an environment in which a person encounters only beliefs or opinions that match their own, so that existing views are reinforced and alternative ideas are not considered. Story 51. Excessive work and stress among healthcare providers are causing many to leave the profession. Many experienced professionals are leaving and not returning. This means that many of their replacements are not receiving proper training. In my city, I have observed many inexperienced workers providing poor patient care. Congratulations and good luck to everyone who left the field. I hope you are safe and happy. Story 52. It will be decades before the effects on the psychology and economic prospects of today's children become clear. In some countries, children miss 2 school years with only bare-bones online and television options to catch up. Children have grown up with constant warnings not to get too close to other people, to sanitize everything, and to wear masks. Do they learn to read a stranger's facial expressions? Do they focus on the eyes instead of the whole face? Older children have experienced a tsunami of hatred, mistrust, misinformation, and division in both their families and their countries. How damaged will they be once they are allowed to vote? I am glad that I do not have children and do not have to worry about their long-term coping. Story 53. 114,000 United States children are now orphans due to coronavirus disease 2019. Around the world, an additional 1.5 million children have lost their parents, grandparents, or other caregivers to coronavirus disease 2019. Every 12 seconds, a child under the age of 18 loses a caregiver to coronavirus disease 2019. Story 54. Many guide dogs lost some of their guiding skills during the pandemic because they did not need to lead their owners anywhere. YouTuber Molly Burke had to retire her guide dog early because of this. This is something many people might not consider, but those who rely on guide dogs have been affected. Story 55. My neurologist mentioned that the patients they see are all high-functioning people, many of whom had minor or asymptomatic infections. An emergency room doctor cannot get certified by his board to work because of cognitive issues. Chief executive officers are struggling to run their companies, and lawyers struggle to practice law. Hospitals are building an entire neurological wing and cannot find enough doctors. Now imagine that potentially affecting millions, even billions of people. Our entire species may be less cognitively capable as a consequence of fighting this virus. Edit. I am a 3-time coronavirus disease 2019 sufferer. You read that right? A long hauler with multiple downstream issues, currently under active care. I was vaccinated. The infection after the 3rd dose was a breakthrough case. Story 56. Frailty in older adults. Many are admitted to acute hospitals with a marked decline in functional ability. Those with dementia, lacking their regular routines, exercise, and social visits, have almost certainly lost years of life. Story 57. As an intensive care unit respiratory therapist, I have had the unfortunate privilege of watching coronavirus disease 2019 patients lose their minds and attempt suicide. This typically happens while they must wear bilevel positive airway pressure masks for extended periods. Some patients rip the masks off, scream, and writhe in their beds. Others remove the masks and say they feel better even though their oxygen saturation falls into the 20s or 30%. Normal oxygen saturation is around 95 to 97%, but with the disease we are lucky to keep them at 88%. They fight us to put the masks back on. At that point, the only option left is intubation and placement on a ventilator, during which they often die. It occurs in about 1 out of every 15 patients who end up in the intensive care unit with the disease and require high levels of supplemental oxygen. It seems completely insane to me, and most people do not know about it. Story 58. Mental health. I am dealing with depression following self-harm. I was suddenly stuck in bed for a month without my medication because of coronavirus disease 2019. Everyone keeps saying I need to have a positive attitude to beat the illness. Story 59. It caused me to lose sight in my right eye for about a month because of optic neuritis, so the effect was more profound in a literal sense. Story 60. No more Taco Bell breakfast. Seriously, this is what I call societal rage. As a member of the retail and service staff, also known as the essentials, I believe people emerging from lockdowns have directed their rage, frustration, and entitlement at those who kept the country running during lockdown. You need us but will not pay us. It is easier to demean us and to tell us we are not worth it. You want us but will not treat us with kindness or dignity. You choose to be mean and to complain. You expect us to follow the rules, yet you often do not. It is easier to think the rules do not apply to you. You demand our professionalism while speaking with hostility. It seems easier not to care. And yet people are stunned and dismayed when a favorite restaurant cannot open until 4 because of staffing shortages. Or when a favorite store opens late because fewer people find it worth coming to work. Even as I explain this in the simplest terms, many still will not understand. I get it. It is not all of you. To those who still tip, say thank you and ask politely, I tip my hat to you. For the rest, reread this. Story 61. Children and young adults are forced to live in hoarded homes with nowhere to go during the day. Story 62. The legal system is so far behind that it is terrifying to think how many violent people have yet to go to court or be detained because of delays caused by the coronavirus disease 2019 pandemic. I filed charges for sexual assault and for assault a year ago, and they have not even reviewed my case yet. The person I filed against is still walking free with no consequences. Terrifying. Thank you for all the replies. They have given me a lot of food for thought. Either way, I think it is a terrible situation, but thoughts and wishes do not change the situation, unfortunately. Story 63. It is going to happen again, and we are not going to change anything about how we structure society or respond to crises. Story 64. Not safe for work tag because the first thing I thought of was how many kids were stuck at home with abusive families. I'm not sure what could come up as an answer. Story 65. Mental health and similar residential programs and facilities are filling up and becoming bottlenecked throughout the entire system. Mental health hospitals, group homes, and residential treatment centers are all affected. Inpatient treatment centers and placements that divert people from jail are much more in demand because of the pandemic. Story 66. Families that used to be wealthy, with young children in the house, suddenly had no food, electricity, or heating. Having to call the families I work with and ask whether there was food in the house was heartbreaking. Many of my students come from artistic families, including freelancers, actors, musicians, and theater workers. Parents went from a high income to almost none because many were self-employed. Parents who could not speak English were unable to apply for financial support, food vouchers, or housing assistance. Story 67. I am a medical researcher and have been conducting research on coronavirus disease 2019 since the beginning of the pandemic. In our meetings, we regularly discuss the long-term effects the virus has on people who have recovered, commonly referred to as long COVID or post-acute sequelae of severe acute respiratory syndrome coronavirus 2 infection. Some severe long-term effects include atrophy of the dura mater of the brain, stiffening of the pleura in the lungs, and atrophy of the ventricular walls of the heart. Other effects include prolonged loss of taste and smell, chronic headaches, fatigue, joint stiffness and pain, and many others. A meta-analysis posted in January 2021 identified 55 different long COVID symptoms reported by patients. Caring for these symptoms will be an ongoing clinical challenge as medical teams continue to develop strategies to manage coronavirus disease 2019. Story 68. Collateral damage. We talk a lot about people who died of the coronavirus disease 2019, but not much about those who died because of it. My husband died because of the pandemic, not from the virus itself. He had been battling colon cancer for almost 4 years when the coronavirus disease 2019 pandemic began. They removed part of his colon, and he received radiation and chemotherapy. He was fine at first, but the cancer spread to his lungs. The plan was to use a technology called the cyberknife to treat any lung nodules that began to grow. One nodule started growing. They performed 3 highly targeted radiation treatments on it. It did not disappear, but it shrank significantly and stopped growing. None of the other nodules showed significant growth, so the plan was to do computed tomography scans every 2 to 3 months to monitor them and to treat any new growth with the cyberknife. All was going well. Then the coronavirus disease 2019 pandemic began. He became too afraid to leave the house for the computed tomography scans. I knew his immune system was compromised, so I was the only one who went out. I wore masks, limited my time outside, and disinfected everything before bringing it into the house. His oncologist canceled his appointments but said he could call if he needed anything. Everything was fine at first, but by May 2020 he began coughing. He occasionally coughed up blood, but he refused to see a doctor or go to the hospital. He reached the point where coughing caused him to gag and vomit. He grew progressively weaker. In August, he felt so ill that I convinced him to go to the emergency room. They performed a computed tomography scan and advised us to contact hospice. He died on August 25, 2020. I am sure many people with health issues did the same, postponing healthcare for fear of contracting the coronavirus disease 2019 only to have other conditions spiral out of control. I know my husband would have died eventually, but I feel that if it had not been for the pandemic, he might have lived another year or two. Story 69. We are in the middle of a bizarre economic bullwhip effect. We have not yet felt the full effects. In my industry, I deal with many raw material suppliers as well as suppliers that provide high-technology equipment. When raw material prices have gone up by 10 to 15% and lead times are 50% longer, that is before our other suppliers feel the same pinch. The compounds. Suppose the supplies B, B supplies C, C supplies D, D supplies E, and E supplies the consumer. If prices go up by 10%, that does not mean you are only paying 10% more. With 5 tiers and each adding a profit margin, compounded increases can be approximately 60% in this scenario. It depends on how many hands touch a product before it reaches the end user or consumer and how high profit margins are. It is dangerous to make any promises or major financial commitments right now. Based on what I see in my industry, do not expect prices to come down for quite a while. Expect 7 to 10% per tier across the board. The wisest course is to eliminate debt because the cost of living is rising daily. Story 70. Speaking from personal experience, I believe heart disease is a long-term consequence. I had coronavirus disease 2019 but did not have any symptoms, and yet I nearly died. One day, I suddenly passed out twice and experienced cardiac arrest. The virus and the body's response weakened my cardiovascular system to the point where my heart could not handle it anymore. Story 71. One aspect no one has mentioned is the effect on conservation. Yes, lockdown has brought some benefits for nature, but it has also caused many negative consequences. In some areas, conservation has lost several years of progress. Story 72. My friends and I cannot walk up the stairs without running out of breath. We had coronavirus disease 2019 4 months ago. Story 73. Yesterday at a dog park, a woman next to me cried. She is a 6th grade teacher and has decided this will be her last year. Since the coronavirus pandemic, her students have behaved in ways she cannot control. They curse at her and bully her. Story 74. It has turned a bunch of people into full-throttle assholes. Story 75. Everyone's a fucking asshole except for the people who are really trying to be human. Story 76. Healthcare workers are becoming completely burned out. Remember when they were heroes 16 months ago? Now they are exhausted, receiving death threats and being called murderers. Doctors and nurses are leaving the profession. Many nurses are worried there are not enough students in nursing schools right now to replace those who are leaving. Story 77. My husband's permanent lung damage. He was a perfectly fit and healthy 34-year-old before coronavirus disease 2019 in March 2020. Now, at 35, he still lifts weights almost daily but has to carry an inhaler because sometimes the stairs are too much for his lungs. With the wildfire smoke, he has been using it a lot. What damage is permanent, you ask? We would like to know too. After thousands of dollars in tests, the doctor said, "We can see the smoke but not the gun." They still do not know all the ways this virus can seriously damage the body, so we are treating it as asthma and moving forward slowly. Oh, and he snores like a bear now. He never snored before coronavirus disease 2019. Now I buy earplugs in bulk. Story 78. My stepdad's friend died of complications from coronavirus disease 2019, and my parents are probably still going to blame it on the fact that he used to work with fiberglass and therefore couldn't possibly have died from coronavirus disease 2019. I feel like familial relationships are turning to dust, like the snap from Thanos. I can't trust them with anything anymore. I did not know the man, so I am not personally upset by his passing. I am angry that even his death will not change my stepdad's and mother's minds, despite the evidence being right in front of them. Story 79. Complete loss of faith in government, in groups of people, in the media, and in humanity. Story 80. Reduced social interaction has many ripple effects. Our immune systems are less effective because we are staying at home or remaining in the same places more often, with less exposure to varied environments. Isolation reduces social engagement, which can increase social anxiety, irritability, impatience, and intolerance. Physical health declines unless we are intentional about getting up, going outside, moving around, and exercising. Story 81. As a teacher in a country that halted education for 14 months, I believe people do not understand the long-term effects this will have on children. Academically, most children will be roughly a year behind. Those most affected were students about to graduate and enter college. College entrance exams were delayed, and some had to retake exams after 12 to 14 months without proper studying and under high stress. The real problem is social skills. Learning to work with other children is essential during the formative years, and we deprive children of that for 14 months. This will have a profound social impact on many children in the years to come, and no one is doing enough to prevent it. Story 82. I know a lot of us are probably in the middle of this right now, But the severe disillusionment of everybody I know in their 20s is already an existentially destabilizing point in one's life. How are we supposed to dedicate 1/3 to 2/3 of our lives to a career that will drop us without warning if anything bad happens? How do I build a career knowing an entire industry could be decimated within a week? How do you even think about raising a family knowing that? How do you even meet anyone to raise that family with right now? What do you do about the people in your life who you love becoming bitter and refusing to accept even the bare minimum responsibility for keeping others safe? How do I plan for my future? Where do any of us go from here? Many of these are trials everyone faces, but ideally they are experienced over years or decades, not many of them at once, while almost all of your peers are going through the same thing. What is that going to do to this generation and to the younger ones? I shudder to imagine what being a child is like right now. Or maybe everyone has always felt this way around 25. Sucks either way. Story 83. My dentist's office was not seeing patients and I had a cracked tooth that eventually broke. A year later, I finally got an appointment and they fitted a crown. It cost $1,000 and was considered cosmetic even though it was the third tooth from the back. The crown was slightly too large and within a few days it cracked the root of the affected tooth, causing severe pain. It took 3 days of constant pain to get an emergency appointment, and the tooth had to be extracted. I paid a large sum for the same result. Story 84. What scared me most was noticing how little being confined alone for weeks or months affected me. It actually had positive effects. I found an online job, got a cat, and cooked a lot. It made me realize I have been exactly like my father all along. I am not shy. I just do not enjoy people, and I will die alone just like he did. Story 85. It furthered wealth inequality. The fact that wealthy people actually benefited from a global pandemic is pretty dark. Story 86. When you die from coronavirus disease 2019 and a funeral home worker comes to pick up your body, the first thing they do is cover your face with a cloth, then spray your face with industrial disinfectant until saturated. This is to prevent any leakage when rolling and flipping the body. The next step is to roll the body into a no-leak plastic body bag. They zip it up and mark the bag as contaminated. Reported by a nursing home worker. Story 87. Short answer. Forgotten people. I know of 2 people who, during lockdown, died and were not discovered until weeks later. They were regulars at a bar where I worked, and someone would have noticed if it had been open. They had no local family. I am not saying their deaths were avoidable, but I doubt they would have been left to decompose for weeks if it had not been for coronavirus disease 2019. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.